Hello friends, welcome to TECHQUEST channel. This is for the medical technologist by your tech. In this video, we will discuss about report validation. Many of you have issues in releasing the results to the patient when the results are ready from the instrument. When the results are within the reference range, they are reported immediately. But when the results are out of reference range, the technologists are responsible to report these results. This video explains each step to check the abnormal results and release the accurate results. The technologist must have sound knowledge of each test reference range, abnormal disease conditions, correlating other lab tests, and the lab instrument conditions. When the results are within reference range, they are reported immediately. If they are abnormal range, in the critical range, for example, glucose below 50 mg per dl and above 450 mg per dl are repeated as per the SOP of many labs. The repeat testing ensures the instrument's precision and correct the random errors. If the repeat results are the same, report and inform them immediately if they are in critical range. We cannot waste the time when they fall on turnaround time protocol. The non-critical range test results need further detailed investigation before they are reported. Next check is the delta check. Some patients' previous test results that correlates with this report. For example, patient's sugar reports are always high for this patient and this is also high. We can report this result. Next, we don't have the previous results and we are getting abnormal results. Correlate with other lab results. For example, when heptoglobin level is low, look for LDH hemoglobin results showing evidence of hemolytic anemia. Patients' results correlate with other lab results, we can confidently release the results. Next, we don't have any correlating results. Check for any possible issues with the patient sample. Check the patient sample for hemolysis, lipemia, or fibrin clot. These can interfere in test results. For example, the hemolysis of RBCs can release potassium to the serum and cause increased potassium results. A small fibrin clot can partially block the sample aspiration probe and decrease the test results. If the sample is not suitable for testing, order a new draw and do not release these results. Evidence of sample contamination. There are two major types of sample contamination. If the phlebotomists don't follow the order of draw, the anticoagulants can contaminate the plain tubes and interfere in chemistry results. For example, potassium in the EDTA can increase the potassium results and EDTA can interfere with many test results. For example, calcium, phosphorus, magnesium. The second method of contamination is from the IV fluids. The sample collected from the same arm getting IV fluid can get contaminated with the fluid. These samples are diluted and interfere with glucose, calcium, electrolytes results. These can be detected with the previous results or very abnormal results or with hemoglobin results from the sample collected at the same time. Any IV contamination should be reported to the other sections to alert them not to report the results. All contaminated samples should be redrawn with special instructions and rerun with new sample. Evidence of sample mismatch. Many times, mismatched samples are detected with the previous results. Patient having abnormal results with previous normal reports, normal results with abnormal previous results are carefully investigated for sample mismatch. A blood grouping may sometimes the evidence of mismatch. Do not report the results and order for redraw and alert the other sections to avoid giving wrong reports. Instruments QC check. Check the QC results for the particular test and the validation time for the last QC done. For some instrument, QC, calibration and the reagent stability can be extended that can give a wrong results. If there is a QC issue, stop running the test for other samples also. Fix the QC issue and rerun all the samples if the QC is okay. We will move on to the next step, instrument condition. Check other sample test result and other test. If we are getting all low or high for all tests, it indicates there is something wrong with the instrument. If there is an issue, stop the instrument and fix the instrument issue, run the QC. If the QC results are within acceptable range, run the test. Test issue. Check the abnormal test results. Are we getting continuous abnormal results for this particular test, or you have a doubt? Run the QC and the QC results are acceptable. It shows the instrument and the test method and the reagents are okay. If issues, fix the reagent, calibration and QC. If all these steps are good, rerun the test and report the results. Rerun can eliminate random errors. The technologist reporting the results must check the instrument condition periodically by looking at the results bias in any instrument or any test should be noted and the results should not be reported. The technologist has the responsibility to detect the pre-analytical and analytical errors before reporting the test reports. Reporting of each erroneous results will affect the hospital and the lab reputation. Thank you. Thank you for watching. Please subscribe for more videos like this.